Thank you, Professor Zheng and Chairman, ladies and gentlemen. It's my great honor to join this session and introduce you an ongoing trial we are in China on home blood pressure. The name of the trial is Home Blood Pressure Intervention in the Community. As we all know, nowadays in the management of hypertension, out-of-office blood pressure are increasingly used in our clinical practice, including the 24-hour ambulatory blood pressure monitoring and the home blood pressure monitoring. And with regard to home blood pressure monitoring, we know that it has a lot of important clinical values. Firstly, it can increase awareness of hypertension in population by promoting subjects measuring their blood pressure at home. And secondly, it can improve the accuracy of hypertension diagnosis by identifying white coat hypertension from office hypertension and by identifying masked hypertension from office normal tension. So it can improve the accuracy of hypertension diagnosis. And thirdly, we know from a lot of prospective studies that home blood pressure is more closely associated with outcome than office blood pressure. As shown in this slide, in the famous Ohasama population study, home systolic blood pressure was significantly associated with all-cause and cardiovascular mortality, but not the screening office systolic blood pressure. So office screening, even in the research setting, the screening office systolic blood pressure was not associated with the outcome. And fourth, but not the least, home blood pressure, we know that is a kind of activity intervention, so it can improve the patient compliance to the antihypertensive treatment. So therefore, it can improve the control rate of hypertension. As shown in this slide, in a real-world Korean study involving more than 7,000 patients, we can see that the proportions of drug skipping or lessening decreased after home blood pressure monitoring by about 86% to 53%. And then, therefore, we can observe that the control rate of hypertension increased from 32% to 59% after home blood pressure monitoring. So home blood pressure monitoring indeed has a lot of value to improve the hypertension awareness, treatment rate, and control rate. So we can see that in the Japanese hypertension guideline 2019, in addition to office blood pressure, home blood pressure was recommended for the hypertension diagnosis as well as for the hypertension grading. And also, in the recently released Chinese Hypertension Guideline 2024, home blood pressure monitoring was also recommended for the hypertension diagnosis and grading. So the home blood pressure monitoring, the important value of this blood pressure monitoring has gained a lot of recommendation by the guidelines. However, in the real world, we still have a lot of barriers or problems in the use of home blood pressure monitoring. For example, to perform a standardized home blood pressure monitoring, doctors need to spend a lot of time to train the patient. And however, patients may be often used invalid or inaccurate blood pressure monitors at their home. And sometimes they report the data with bias to some extent. And in some patients, home blood pressure monitoring may induce anxiety. And in general, with the common blood pressure monitors, there is no information on nighttime blood pressure. And And very usual problem is currently we have no standardized report for home blood pressure monitoring. Patients often record their home blood pressure at papers and to show to the doctors, and doctors cannot immediately judge how the blood pressure level for these patients. So in recent years, with the use of the international technology, in collaboration with information technology in Shanghai, our team developed a web-based blood pressure monitoring, data transmitting, and reporting system. And within this system, the patient can get a validated blood pressure monitoring for their home use from the hospital. And after being trained how to perform a standardized home blood pressure monitoring, after the 7-day home BP monitoring, they can get a standardized report from a clinic of the hospital. So this shows a standardized professional home blood pressure report which can be automatically generated by this web-based system. And this kind of standardized home blood pressure monitoring has been applied into our clinical practice, at least in Shanghai. In November 2024 2022, this kind of home blood pressure monitoring has been approved by Shanghai Medical Insurance Bureau, and it can be charged in our hospital as a clinical examination technique. So if we recommend home blood pressure monitoring to be used in the clinical management of hypertension, one of the important questions is we need to recommend the blood pressure target after treatment. So we can see that in the Japanese 2019 guideline, they recommend two targets. The usual target, the higher target of less than 135/85 was recommended for older patients aged 75 and over, and patients with cerebral vascular disease, and a lower home BP target in corresponding to a lower office blood pressure target of less than 130/80 were recommended for adults younger than 75 years and patients with high risk, including with cerebral vascular disease, coronary heart disease, chronic kidney disease. But however, all these recommendations might be based on the the Japanese observational studies on home blood pressure monitoring. We can see in the famous Ohasama population study, home blood pressure was associated with increased stroke risk, both in untreated subjects and treated subjects. And in treated subjects, the lowest hazard ratio were observed in patients with the normal range of home blood pressure, that is 115/75 to 124/79 millimeter of mercury. And also in treated patients in this large sample-sized honest study led by Professor Kazomi Carriel, we can see that in this study involving more than 20,000 outpatients, home blood pressure was associated with outcome. The lowest hazard ratio were observed with a home blood pressure at a level of 124 millimeter of mercury systolic in the whole day and in morning, evening. And so the recommendation in the Japanese guideline, the home BP target, might be based on these observational studies. And only one trial investigated the home BP target, that is the HOME-MED BP trial. This trial involved more than 3,000 patients. They were randomized to usual control or tight control of home blood pressure. But unfortunately, after a median of more than 6 years, this trial did not observe any difference between the two groups and did not achieve any blood pressure difference between the two groups. So up to now, there is no direct interventional evidence supporting that a lower home BP target will be beneficial for patients. And considering there is very few outcome study on home BP was carried out in China, so we designed this home blood pressure intervention in a community trial. And it is randomized, controlled, open-designed clinical trial. We intend to investigate whether a lower target of home BP level would be associated with better outcomes. And another purpose is to promote the use of the standardized home BP monitoring in the management of hypertension in our community hospitals. So we would like to include those elderly patients aged ranging from 60 to 80 years, those having taken antihypertensive drugs for at least 2 weeks, and their home blood pressure was not controlled according to current threshold. And those patients with inappropriate conditions will be included from this trial. And those eligible patients will be randomized to two groups, two target groups. One is the lower target BP group of less than 125/75 millimeter of mercury. Another is less than 135/85 millimeter of mercury. And the patient will be followed up for 4 years after randomization. First monthly for the first 3 months and every 3 months thereafter. And all the treatment judgment will be based only on a 7-day home BP measurements before each clinical visit. And the decision will be made by both the community hospital doctors and also the experts at the tertiary hospital. So the primary endpoint will be the composite cardiovascular endpoint, including cardiovascular death, non-fatal stroke, and myocardial infarction, hospitalized heart failure, and unstable angina pectoris. And we estimated the sample size. We will need at least 10,000 patients, and we will recruit these patients in about 200 community hospitals across China to complete this trial. So in this trial we will use I introduced the web-based home blood pressure monitoring system. So all the home blood pressure data will be automatically transmitted into this system and will be communicate with between the community hospital doctors and the tertiary doctors at the tertiary hospitals. And we are very grateful that the ND company, Japan, provided these blood pressure monitors with automatic transmission function to this trial in this patient. And this trial is now supported by our institute, Shanghai Institute of Hypertension. And Professor Ji Guangwang and I are PI of this trial. We intend to complete this trial in the next 7 to 8 years. And this trial was kicked off in March 2023, last year. And after the 1 year and a half hard work, more than 4,000 patients have been screened, and more than 2,000 patients have been randomized. And I would like to very briefly show you the baseline characteristics of the randomized patients. And the mean age was about 69, 70 years. About half of were male, and the mean office blood pressure was 140/80. 79 millimeter of mercury, and the mean home BP was 145/81 millimeter of mercury. So in conclusion, home blood pressure monitoring as a very accessible out-of-office blood pressure measurement, it has a lot of clinical values in the management of hypertension. It can improve awareness, treatment, and the control rates of hypertension. And it should be widely used in our management of hypertension in our clinical practice. And our trial, I hope, will help to promote the use of this web-based standardized BP monitoring system in China and improve the quality of hypertension management in community hospitals. And hopefully, it will also give an answer on the optimal home BP target. Thank you for your attention.